So without any further ado, I would like to welcome our next presentation and extraordinary woman. Her name is Dr. Bareket Schiff Keren. You would have seen her in the audience early on. Her presentation today is A Place for Medicinal Cannabis in Rehabilitation. And just a little bit of background. So by way of background, Dr. Bareket works in the Tel Aviv Medical Center as a pain specialist and anesthesiologist. Her aim over almost 4 decades has been to help patients to recover and regain their well-being. After her introduction to the medicinal attributes of cannabis by patients, she's found medicinal cannabis to be the sole effective therapeutic agent for a number of them. And in fact, we were told by Zach Klein that you are the go-to person in Tel Aviv. So she looks forward to sharing her observations, of course, today and thoughts regarding her Israeli medicinal cannabis experience. So please welcome to the stage Dr. Bareket Schiff Keren.
Hello, everybody. Hello. I see it's a really intimate audience now. Maybe they're still outside. Actually, my talk now is a continuation of what I've said in my previous talk. So I will just go briefly on things that I've said before. First of all, I have to mention that cannabis as a rehabilitation treatment was never studied, actually, so as far as I know. So I cannot cite anybody else who said something about it, and I can cite no documents about it. But that's my feeling, according to my experience using it with my patients. So I will say again what is, I think, very important for the next talk. First of all, I have to repeat the definition of pain because I'm treating pain. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. That means, for instance, that fibromyalgia, which is actually generalized central hypersensitivity in which people, especially women, it's 10 times more common in women, describe that they have pain all over, in the joints, in the muscles. They have irritable bowel and irritable vesicle, and they have also headaches, and they have pains in their jaws and all over. They cannot sleep at night. They can concentrate during the daytime. There are people who just don't believe that such a disease exists. So the thing is that one who treats pain has to be an empathic person and to believe the patient who tells him about the pain, because the actual tissue damage doesn't always exist. It's a kind of emotional experience, which is something that one has to believe to. The second thing that I want to refer to is what is actually health. The WHO definition of health is physical, mental, and social well-being. So what we are aiming at as health givers or health providers is giving actually the well-being for the one we treat. We cannot cure almost anything. There are very few diseases which we can make the patients recover or whatsoever. Mostly they have to live with a kind of disease or infirmity and to lead good life and fulfillment. So that's where I come. So lately, just a month ago, I've been to a meeting which was similar to this one, also organized by patients organization which is called Patients Out of Time, and there I saw again the thing that is actually leading the whole cannabis treatment area, which is the patients are taking over and actually leading their caregivers to give them the treatment. And I saw it, we all saw it this morning with the people, with the women who had their children being treated with the epilepsy and with autism. That is something that actually they were breaking the law in order to get the right medicine for their children. And we see it with a woman who's really leading this whole symposium, who took the law in her hands and gave her a son the treatment that he needed. And actually, that was the only treatment that really relieved his situation. So what the patients tell me is that the cannabis is giving them a lot of relief. The pains either disappears whatsoever, wears off, or if it persists, one can put aside the pain and can get on with the everyday life. So what is all what we call rehabilitation about? Rehabilitation is about living with whatever disability and disease that we have. So actually, the experience with cannabis is really rehabilitation. And whatever people think that the cannabis is working on the minds, so what? If we want, there are so many patients who are desperate and depressive, and if we give them anyhow, we give them antidepressants, why don't we give them just cannabis, which also is working on the minds, and it's doing only good. It puts the pain and other worries aside, and that's very important with rehabilitation. Okay, I want just to present one of the patients that were speaking there was speaking there in California last month. His name is alive, Mr. Irvin Rosenfeld. He has some kind of a disease which is called multiple congenital cartilaginous exostosis. That means he has growth tumors in his bones, and when he was already 10 years old, thinking that he's completely healthy, he realized that he has 200 tumors all around his body. He underwent a lot of operations for these tumors, and he discovered when he was almost at the age of 20 or 23, he discovered that cannabis was the only medication that really relieved him. Where it must be told that all along the time, with the operations that he underwent, he got a lot of other medications, of course, including a big dose of narcotics. And that was he was born in 1953, and at the age he was 20 in 1973, as you can figure out, and from that time on, he was applying for a license to get cannabis. And that time, the government of the United States was making some kinds of experiments on cannabis. So he was applying, and as at the course of events, he got this license. So he has about 25 years a permission to use cannabis from the federal government of the United States. And you can see him holding the batch of cannabis cigarettes that he gets from the ministry, from the government, from the NIDA, and it's about 300 cigarettes. He gets 300 grams of cannabis. It's not a very good cannabis. It's just 5% THC, but one can see that this is what it takes for almost more than 25 years, which is quite a long time, and he's still around, and he thinks clearly, and he's functioning. He has his own workshop, is doing carpentry, and one can see that he's walking a little most of the time in his wheelchair, but you could see that even though 25 years he's using this cannabis, he's still around, very functioning and clear and fighting for the other fellows to get the cannabis for their disease. Now since there's actually no studies about rehabilitation, I just want to show my patients. Here we have two patients. The one with the two legs which are amputated. You can see one is above knee and one is below knee. Both are, of course, army survivors. One is the one that with the two legs which were amputated. He has recovered and has two daughters and is working. And just to mention, everybody of them was willing to show his face. Nobody wanted to hide. So that's why I show him their face. And with the cannabis, he could taper off all the medication that he had before. The other one is actually an Israeli hero. There's a nomination of Israeli hero for what he lost his leg for. And nowadays that he has the cannabis, he's running in competitions for the disabled. And of course, he's very, as you see, very active and is active with the cannabis as well. These are two women that underwent terrible road accidents. They were the one on the right side of my right side. She's also she had cervical spine injury as well as some brachial plexus injury. So you see her left. Her hand is just paralyzed. She can hardly use it. She has terrible neuropathic pain. Despite the fact she's working now, she set her own house, and she has been rehabilitated. The other one also underwent a terrible road accident. She had several operations. And they offered her to amputate her hand because she cannot use it whatsoever. It's very heavy. It's just hanged. But she said, no, I want to have my hand. She gets cannabis, and nowadays she's married, she has a child, and she's living normal life. This is a man who has a disease which is called Buerger's disease, thromboangiitis obliterans. It's a disease in which the small blood vessels are getting obliterated. It's usually connected with smoking. This patient, of course, cannot take cannabis in smoking. He's inhaling it through an inhalator, and it's the only thing which relieves his pain. He has terrible pain. You can see that he's going to lose the fingers that he still has. He lost his one leg, and he is, of course, moving in a wheelchair. But the cannabis is the only medication that relieves him, can put him to sleep, and gives him the ability to have normal life. This patient has rheumatoid arthritis. As we heard from the previous speaker, cannabis is also working on the immune system, and rheumatoid arthritis is autoimmune disease. She still takes some other medications. She's also on biological treatment, because that's the treatment one gets for rheumatoid arthritis. Nevertheless, she can lead somehow normal life. She can cook. She's a widow. She has to take care of everything in a house. So that's what she's doing with the cannabis. This patient underwent explosion, a terrorist attack. By the way, those who underwent explosions, those who were in the war, those who were in the army, they are all post-traumatic pain syndrome as well. They have also post-traumatic pain syndrome as well as the pain that they've got due to whatever they underwent. I wouldn't show you anybody with just PTSD because one cannot see anything on patients who have PTSD. They have to tell you the story and you have to listen to them. And besides, it's Sue's job to tell you about them. But this patient, for instance, underwent this explosion and he had you see, on one leg was was hurt by the explosion, whereas the other leg took a vein and a nerve to transplant for the other leg. Now, this is a patient who has a progressive hereditary muscular dystrophy. He's all distorted. Once he falls down, he cannot stand up. One has to help him. And he has terrible spasticity, and the spasticity causes him excruciating pain. Even when he wants to sleep, when he sleeps and on one side, he cannot change. He cannot roll over to the other side without the cannabis, and the cannabis is doing wonderful work for him. This is a 43 years old lady who underwent a road accident about almost 17 years ago, and she harmed the cervical spine, and you see the left hand is also underwent an injury, and later she went into depression and eating disorder. You can see she's very, very thin. The eating disorder caused her osteoporosis and some crushed vertebra. Very, very terrible, very painful situation. And then she was diagnosed with carcinoma of breast. But with the cannabis, she somehow rehabilitated, got married, had a child, and that's how she looks now today. If that's not a rehabilitation, what is a rehabilitation? Now, nowadays, the Ministry of Health in Israel agreed, according to teratologists in Israel, that people or women who get cannabis during on everyday life, once they get pregnant, they don't stop the cannabis. They go on with the cannabis because comparing with other medications for pain and for other diseases that these patients would have gotten if they wouldn't have the cannabis is the best medication as the less harmful one for the babies and for the mother, because the mother, as you know, is very, very important in this process. According to the Jewish tradition, the mother is the first to be treated, and only later the offspring. So for women who are pregnant, they don't stop the cannabis for their pregnancy. They don't start cannabis at the beginning of the pregnancy, though Melanie Dreher, about, let's say, 30 years ago, described women in Jamaica who used cannabis as a medicine for nausea and vomiting during pregnancy. She studied them over their pregnancies and followed the babies like 5 years afterwards. And she found no difference between women and children whose mother had cannabis during the pregnancy, in the mental development, and in the whole way long. Not the growth, not the weight of the baby, and not the mental development. So nowadays in Israel, women go on getting cannabis during pregnancy for anybody who's interested. Now, there are other diseases. Of course, we have heard about epilepsy. ALS is not on the list of the indications in Israel, though there are patients with ALS who get cannabis. Spinal cord injury is not on the list unless one has neuropathic pain, but it works. Parkinson's is already on the list. Fibromyalgia is not on the list, but I'm fighting for everyone because I think fibromyalgia, there's no treatment for fibromyalgia but the cannabis. That's the only thing which helps them to get over and to somehow regain the normal life. CRPS is a very terrible, it's a terrible situation in which people are really disabled with very little damage that occurred to them, and later on develop a situation in which they can hardly use the limb that was injured. And it's it's something that spreads all over the body. It comes in a mirror image. It goes all along the same side that was injured. And it's the only way to stop it is to make the person work with whatever limb was harmed. And the way to make them work is not opioids, is not any other medications, it's not injections, it's the cannabis. So this is the thing that I found. Endometriosis, if anybody knows what it is, it's a devastating disease which is apparently happening very often, not as one thought before. It's about 1 to 20 of the women around the world, and it's causing terrible pains and disability. And endometriosis is helped by cannabis. It was found that the uterine and all the reproductive system is very rich with CB1 receptors. So actually the medicine that should be given to them is actually high THC products, and that's what they get. Neuropathy, I was talking about it at the previous talk, and you could see here Zach Klein treating one of the elderly because he used to take cannabis to an elderly home and treat the patients there with cannabis. And I was a witness once. I came to this place and I saw these people. They were happy. They were eating. They had no tremor. They slept well, and it was really a good sight to see visiting these elderly people home. And that's what I say. It's all about rehabilitation because we can hardly cure anything, and we have to be humble and we have to admit it. And there's another thing that, of course, I have to add, that we don't know what we are really giving the patients, as Daddy Meiri has said previously yesterday, and he added it today, that actually we don't know, and the fact that Professor Meshulam is pulling towards CBD, or CBD only, high CBD, and we are in Israel using high CBD for epilepsy, and the patients here, they are treated with THCA and get the same results actually with epilepsy, means that we really don't know. So I don't know what I'm giving. I'm giving the patients, I'm applying for a license, the patients get a license, and once they get the license, they try whatever they need, whatever they can, as much as they can, and they find out what is the best for them. And then Daddy Meiri gets the results of what they get. So he might be able to find out later on when he has a big survey to match the patients or the disease to the kind of cannabis that the patient takes. Now I have to mention just a little thing. On that meeting about a month ago, there was somebody telling us about a book that was written by a big group of people who were recruited by the National Academies of Sciences, Engineering, and Medicine by the federal government of the United States, which was actually to find out the health effects of cannabis and cannabinoids. And their outcome was, according to 24,000 papers that they read, and they kind of made them in order of strong evidence and less strong evidence and so on. And it was the current state of evidence recommendation for research report last year, just recently. And I read it all, and what they came out was the therapeutic effects was the conclusive and also substantial evidence for treatment of chronic pain, as I told you already, an antiemetic for chemotherapy-induced nausea and vomiting, as many of you know, improving spasticity in multiple sclerosis patients, moderate evidence for sleep disturbances and fibromyalgia, limited evidence for weight loss and increasing appetite for anxiety and PTSD, brain injury and stroke, dementia, and glaucoma, which is really striking because we know all these situations are very, very well handled with cannabis. And they said that there's no or insufficient evidence for cancer patients, including gliomas, epilepsy. We saw that there's a lot of evidence, ALS, spasticity due to spinal cord injury. And I saw a patient with spinal cord injury taking cannabis, and all of a sudden the spasticity goes away, just fading. I saw it with my eyes. Parkinson's disease. I saw patients using cannabis, and all of a sudden the tremor is relieved. So all this is very, very strange. Irritable bowel syndrome, worsening of any psychiatric disorders, adverse effect of immune disease system, increased risk of myocardial infarction. Okay, they didn't find anything about this in the literature they were viewing, but it's strange. And then inconclusive data about diabetes and metabolic syndromes, and they couldn't say anything about teratologists. And then I bought the book and I read it, and I was amazed. They had nothing written there about inflammatory bowel disease syndromes like ulcerative colitis, Crohn's. These we know. I know somebody was really doing research into it, and she's very well famous, and it's very, very obvious that this works for them. Autoimmune disease. We heard the previous talk about that in autoimmune disease, there's no doubt cannabis is doing something, is relieving whatever the autoimmune disease. And in Israel, there was a big study done for graft versus host reaction with the cannabidiol, and apparently the graft versus host reaction, which is actually something which is causing death, went down in 50%. And they wouldn't speak anything about children and infants. So I called them. I called this person who presented it, and I said, look, you've written a book of 400 papers, and there are a lot of things missing. What is it? What is it all about? You're going to recommend the federal government about using cannabis, and there are a lot of things missing. And you know, and we all know that we are very much following the federal government of the United States. Very, very humbly, I must confess that this is the way it is in the world, because we regard the United States as the place where most of this research is done, or a lot of research is done, and a lot of money is invested into research. So what would he say? So they answered me. The officer who was in charge of all this operation wrote to me back that unless there will be a recruitment of all this group and refunding of this group, nothing is going to be changed for the time being. And their recommendation was to go on with research, because the research up till now is limited due to regulation, so we have to change the regulation and to make an access to well-controlled product and to learn more about the complexity of the cannabis, as Dedi Meiri has already showed us. Now, for the time being, we are here to make the change. The patients are waiting for us to take the hot potato and work with it, not throw it from one to the other. And thank you.